representative of the Executive Governor of Sokoto State, distinguished President and national officers of Mdcan, past presidents of Mdcan, I can see Professor Mohammed, Professor Udofia, and Professor Sani MNI, esteemed consultants, fellows, and members of the medical and dental professions. Let me not forget the Board of Trustees, the CMD of Udud, my friend, Professor Anas, and through you to the management and staff of Usmanu Danfodio Teaching Hospital, University Teaching Hospital. DG NICRAT, Professor Malami, other members of the high table, distinguished guests, ladies and gentlemen. I bring you warm greetings from the Honorable Minister of Education, Dr. Tunji Alausa, CON, who is deeply honored to be invited as the guest of honor at this important National Executive Council meeting of Mdcan. The Honorable Minister deeply regrets his inability to be physically present due to other pressing national assignments, but he has asked me, as his special advisor technical, to convey his goodwill, solidarity, and unwavering support to Mdcan and to Nigeria's medical and dental consultants nationwide. The theme of this conference, strengthening the health force for effective service delivery, defining roles and fostering collaboration, could not be more timely or more aligned with the strategic direction of the Federal Ministry of Education. From the perspective of the Honorable Minister, there can be no resilient health system without a strong, well-funded, and future-ready education system, particularly in the training of doctors, dentists, nurses, pharmacists, and allied health professionals. Education, health, and national productivity are inseparably linked. Since assuming office as the Honorable Minister of Education, my boss, Dr. Tunji Alausa, CON, has deliberately positioned the education sector as a critical enabler of health sector reform, with targeted policies and investments that address the long-standing workforce and infrastructural gaps confronting our hospitals and teaching institutions. Permit me to highlight a few landmark interventions that the Honorable Minister has undertaken that deeply support the objectives of this conference. 1. Expansion of medical and health sciences training. The Ministry has worked closely with TEDFund to double enrollment in medicine, dentistry, and pharmacy, and to quadruple enrollment in nursing in response to Nigeria's health workforce needs and global competitiveness pressures. Massive investment in medical education infrastructure. As you must have heard, over 120 billion has been invested and earmarked for the rehabilitation of 18 medical schools across the 6 geopolitical zones, alongside the construction of 8 state-of-the-art medical simulation laboratories, ensuring that medical graduates are trained with modern, competency-based tools rather than outdated theoretical models. This makes the work of Mdcan members who teach these students easier and more rewarding. I think the Honorable Minister deserves a round of applause. Improved student welfare and learning environment. An additional 27 billion naira has been earmarked for new hostel facilities in these medical schools, recognizing that students' welfare is fundamental to learning outcomes and professional discipline. Stable academic calendars and industrial harmony. Through sustained dialogue and leadership, the Ministry has helped secure uninterrupted academic sessions in federal tertiary institutions with the recent ASU agreement, which will restore predictability to medical training pipelines and ensure that residency and consultant level progression are no longer disrupted by systemic instability. These interventions are not abstract policies. their deliberate investments in you, the healthcare professional workforce, and in the patients you care for day in, day out. The sub-theme of this conference, Optimizing Professional Accountability and Legal Preparedness in Healthcare Practice, speaks directly to the realities of modern medical practice. As medicine becomes more complex, technology-driven, and publicly scrutinized, professional accountability, ethical conduct, and legal awareness are no longer optional. They are essential components of a quality healthcare delivery system. The Honorable Minister strongly believes that effective collaboration between medical professionals, educators, regulators, hospital managers, and policymakers is the only pathway to protecting practitioners, improving patient outcomes, and rebuilding public confidence in our healthcare system. In closing, ladies and gentlemen, distinguished guests, the Federal Minister of Education under my boss, Dr. Tunji Alausa, remains fully committed to working with Mdcan, teaching hospitals and professional bodies to produce competent, ethical, and globally competitive health professionals in line with the renewed hope agenda of President Bola Ahmed Tinubu, GCFR. On behalf of the Honorable Minister of Education, I commend Mdcan for its leadership, professionalism, and continued advocacy for excellence in healthcare delivery. I wish your deliberations a successful outcome and pray that your resolutions translate into stronger institutions and better health outcomes for all Nigerians. Thank you for your attention. God bless Mdcan. God bless Sokoto State, and may God bless the Federal Republic of Nigeria.
Thank you, sir. Thank you, sir, for this wonderful presentation. And we will bring